Hello, my lovelies. My name is Dr. Lisa Mateka, and I help those with cancer navigate their inner journey towards health and wellness on all levels, physically, mentally, emotionally, energetically, spiritually, to stack the odds in their favor and self-realize wholeness without having to suffer and figure it out alone. And today, I'm going to be doing part one of a two-part short series. Stay tuned in a week or so for part two. So I'm going to be sharing with you more than ideas and advice, but actual techniques and practical applications that may help you in dealing with emotions. Ah, yes, emotional mastery. This is always something to strive for because if we don't master our emotions will master us. We will be living at effect rather than at cause. You can check out my past video, the most important thing I've learned about cancer, and this really just points out that there is a relationship between cancer and emotions. But here we will get more into the practical applications. So before practical applications and techniques, one basic, foundational, yet profound concept is content versus context. So content is the stuff of our lives. Content is my body has cancer. Context is the meaning that we ascribe it. So just take a second, if you haven't reflected on this already, and see what comes up for you. What kinds of thoughts and emotions have arisen since your diagnosis? Are you thinking more along the lines of, why me? Bad things always happen to me. I've tried my best to take care of myself and I'm a good person, and yet I've still been punished with this awful disease. Or are you just absolutely terrified, scared shitless that you may have to leave this life that you're not ready yet to leave yet? Or have you already figured out to have a more empowering perspective, such as, I don't yet know why this is happening, but I'm going to use this opportunity to really focus on my whole health in a way I have never been motivated to do before, and see what I can learn and use this time to become more of who I'm meant to be. Now that last one, I didn't make that up. That came from a real patient, real patients, more than one. And guess what? They are doing great now. It really does make a difference. As Tony Robbins says, change your story, change your life. So our story changes by the words we say, by the meaning we give it, not by what happens in that outer world. And it's just an important concept I wanted to outline. So there is an age-old philosophical debate of whether thoughts create emotions or whether emotions create thoughts. I feel like there is supporting evidence for both, and it's really not important here. The important thing is that they are inextricably interconnected. So when we're talking about thoughts, there's going to be emotions involved. When we're talking about emotions, there's going to be thoughts involved. So just know they pretty much are a package deal. Thoughts can feed emotions, emotions can feed thoughts, and they are often, or almost always, coming together, appear together. So why is this important in general, this whole emotional thing? Well, again, so another way to put it, when it comes to cancer, the diet you should be more concerned about, although yes, physical or nutritional diet is important, but it's really the thoughts you are thinking and the emotions you are feeling. That is the diet that perhaps is even more important than what you put in your mouth. These are what affect your vibration and your frequency. And even if you don't believe in that kind of stuff, these are what affect your outlook, your decisions, your behavior, and absolutely that has an effect on cancer progression and outcome. It definitely affects your response to cancer. You can also see my video, Frequency Beats Chemistry, the #1 state that will shift cancer. This is mostly about gratitude, but it does kind of underscore that our frequency really is more important than our biochemistry when it comes to healing from this. And this is not conjecture. So some supporting evidence for this, there's many studies that show depressed cancer patients have poorer outcomes than non-depressed cancer patients. And even that depressed cancer patients who get treatment for their depression end up faring better than those that don't. And then there's also plenty of studies that show cancer patients with unmanaged stress also have poor outcomes than those that manage their stress. Not to mention the spontaneous remission studies that show releasing suppressed emotions as well as increasing positive emotions, those two being separate things, releasing suppressed emotions, increasing positive emotions, are 2 of the 10 common healing factors that those with a spontaneous remission had in common, the ones that beat the odds. 2 of the 10. Now, add in, so there's some other healing factors that also are to do with the thoughts and the emotions, and those are empowerment, spirituality, and having, what was that one called? Oh, strong reasons for living, sorry. So those, and I can do a separate video on the 10 common healing factors, but those 5 right there are related to thoughts and feelings, and that equals 5 of 10 equals half of the 10 common healing factors that those with a spontaneous remission had in common. So yeah, just a little bit of evidence, just so hopefully you guys believe me here. Yeah, and spontaneous remissions, they can be subtle. It can be grapefruit-sized tumors shrinking to almost nothing in 24 hours. There's no scientific evidence for this, but these people said what they did was they changed their mental and their emotional state, which changes your frequency. So I believe we can attribute that to that. Just to be clear, of course, the complete mastery of emotions is well beyond the scope of this video series. And really, it truly is more of a journey than a destination. It's always a work in progress. We are human after all. And it's not about never falling off the horse. It's about being able to get back on that horse when we fall. It really is okay. And it's not about not even feeling the bad feelings. It's about how are we responding, reacting, how are we dealing with those feelings. So yeah, and don't underestimate yourself. Big shifts can happen one awareness at a time, one conscious effort at a time. Kaizen, one bite at a time. And another great Tony Robbins reference, he often says, sometimes a 1 millimeter shift makes all the difference. Now, sometimes we need big perspective shifts, we do. But sometimes we just need a little pivot, And the analogy he gives is a 1 millimeter difference is totally what makes the difference between a hole-in-one golf shot versus a bad shot. I'm not a golfer, so I don't know the terms. A 1 millimeter difference is sometimes all that plastic surgeons do when they're changing someone's face to be beautiful or something like that. I guess symmetry is beauty. I mean, I'm not trying to perpetuate typical beauty standards here, but the idea is a 1 millimeter shift can make all the difference. So sometimes we need a big shift, and sometimes the little things can make a big difference. So don't underestimate the little things. Okay, so one of the exercises I'm going to share with you, it's basically an emotional disarmament exercise. And I definitely got to credit this to Peter Sage. He is amazing. Check him out. Check out all his work, everything. He's totally, totally amazing. So he has some techniques. The one I'm going to share today is called treating the knee. He has another one called treating the shoulder. To be clear, this has nothing to do actually with your knee or your shoulder, but the rationale is this. Sometimes, let's say our knee is hurting. We go to our primary care physician and they give us something to treat it, and the pain is alleviated, at least for a little bit, and then oftentimes comes back. So then we go to the chiropractor who does a more thorough analysis. Turns out there was something, misalignment with our shoulder, which affected the curvature of our spine, which affected the alignment of our hip, which then affected the knee downstream. So the idea is the shoulder is the root cause, and to treat that, and this is one of the naturopathic tenets as well, treating the root cause. However, when it comes to these exercises, treating the shoulder and treating the knee, they're both useful. It's not like one is treating the symptom necessarily. They're both useful. It's just, I'll share the treating the shoulder next week. That one is about kind of transforming, I shouldn't say kind of, that one is about transforming significant emotional events from the past that still hook you. And the one I'm going to share today is called treating the knee, and that one is for in the moment emotions that you are experiencing that are undesirable, and they can come from seemingly anywhere. So yeah. So examples for when to use treating the knee. When you catch yourself in some negative emotions, such as fear, which can take the shape of anxiety, panic, overwhelm, worry, feeling stressed. When there's anger, frustration, irritability, sadness, depression, hopelessness, helplessness, despair, confusion, maybe even shame or guilt. These can come from thinking about your cancer, because these are actually pretty common emotions in cancer, so don't beat yourself up. But this technique also, emotions can come from anything. I mean, road rage, you're driving and you don't like the way someone else is driving and it makes you feel some sort of a way, or somebody said something that triggered you. So this technique is for, it doesn't have to be just thinking about, your cancer. It could be coming from seemingly anywhere, people annoying you, anything. So again, the important thing is not about not having these emotions, it's about how we handle them when they show up. So here, just an outline of some common ways people react to emotions they don't like are, one of them is escapism, of course. So please be aware of this when it happens to you. Anything can be an escapist modality. Of course, the typical ones we think of are like drinking, drugs, gambling, sex, food, shopping, burying ourselves in work. I mean, again, anything really. And we think we're making ourselves feel better, but really it's just a masking of the pain. And then the remainder of that emotion is suppressed out of awareness. So, and yes, other ways of, not good ways of dealing with emotions are repression and suppression. Repression is more what happens unconsciously. Suppression is more conscious. So these are like, denial, avoidance, and show up like projection oftentimes. Another one is expression. So it is commonly thought that it is good to express our negative emotions to sort of get them out. So this is not exactly true. Like people think like express your anger, get it out. It doesn't exactly work that way. The expression tends to feed the emotion, adding fuel to the fire. And then the rest of that is suppressed out of awareness. So again, it's not about never falling off the horse, it's about getting back on. A new future is always available. You are never too old. Yes, the more you have sort of had these patterns of these emotions and emotional reactions, it is going to be harder to get out of them because the neural pathways are so deeply ingrained, but it is possible to create a new track in the snow, so to speak. So this technique, treating the knee, it's about in the moment, something you can do to sort of try to take the energy out of that emotion. So here we go. Step 1 is wake up. So catch yourself sleeping awake. Be aware of experiencing an undesirable emotion. This is the awareness part. If you can't do this step, then you really can't do the rest. These steps get increasingly harder. But awareness is an important first step. So even this, pat yourself on the back. Step 1, wake up. So step 2 is identify and locate. Identify and locate the emotion. Be as specific as possible. What is this emotion you are experiencing? And where is it in the body? So don't just say anger. Get more specific. Are you feeling critical? Are you feeling threatened? Don't just say scared. Are you feeling inadequate? Are you feeling alienated, abandoned? Don't just say sad. Well, I guess abandoned goes more with sad, but you get the idea. Don't just say sad. Is it despair? What is it? And where is it felt in the body? Is it the chest? Is it the gut? Is it affecting your breathing, your heart rate? Basically, this one is about knowing what we're dealing with in order to deal with it. So again, I'll repeat. Step 1, wake up. It's the awareness. Step 2 is identify and locate the emotion. And step 3 and 4 get into more mindfulness kind of approaches and techniques. So step 3 is disidentify yourself from the emotion. This is important. Remember, you are not your emotions. You have emotions. You experience emotions. That's actually better than saying you have them. You are not your emotions. You are experiencing emotions. Just like you are not your body, you have a body. Just like you are not your mind, you have a mind. And yes, language is important here. So saying things like, I'm angry, that is totally you embodying and identifying with that state. And that's, language is important. So that's basically not good. So the more mindful approach is saying something like, I am experiencing a temporary state of anger right now. Really, words are important. They really, really are. That's a whole separate conversation. But remember, the feeling is not you. Just because you feel it doesn't mean you are it. Doesn't mean you have to be it. So I guess that's the key distinction here. Step 4 is allow and observe. This is by far the hardest step. If you can do this step, you can release the emotion for good, or at least till next time, but potentially for good. Allow and observe. So this is where my meditators will definitely have an advantage, because this is something that often is done in meditation anyways. So allow and observe. A way to think about it is to step back and sit behind it. Unhook from the thoughts that accompany it, cause it, or perpetuate it. Do not process the thoughts. It's okay if a thought comes in, just like when meditating, you're not gonna beat yourself up about it, but don't follow the thought, don't process the thought. Unhook from the thoughts by replacing that noise with curiosity and non-judgment. The really important part of this is you're giving yourself permission to feel it. You actually want to feel it in this step. You do not want to resist it. You don't necessarily want to like act on it either, but you do want to give yourself permission to feel it. Have a childlike curiosity with questions like, what is this feeling going to do next? Where is it going to go? Is it going to get more intense, less intense? A key distinction here. So it's definitely, I would say, in my opinion, a good idea to ask yourself questions about your feelings, like, why do I feel this way? Where is this coming from? When have I experienced this before? But that is not what we're doing in this particular step with this particular technique. The childlike curiosity is not like psychoanalyzing ourselves like that. It's more like a curiosity about the feeling, like what does it feel like? Where is it going to go? That kind of thing. I hope that makes sense. Yes. So observe and allow. I really hope that made sense. This is definitely a hard one to do. So a little bit of physiology here. When an emotion is experienced, there's actually neuropeptides released in the body, different ones for different emotions. And if you don't feed the emotion and you don't resist the emotion, by the way, resisting is feeding, the chemicals, these neuropeptides, will take about 60 to 90 seconds to complete their cycle, and then they'll be recycled away. The emotion will start to move and dissipate. This is truly amazing, everybody. So you want to, with this step, you want to allow, we're still on step 4, you still want to allow the emotion to do whatever it wants to do. As far as like you feeling it, like allow yourself to feel whatever that emotion is making you feel. Allow it to go wherever it's going to go, transform however it's going to transform. That doesn't mean you acting on it like, okay, the emotion's telling me to go break a TV. That's not what we're saying here, just for distinction. Allow the emotion to do whatever it wants to do. Disengage. Don't resist. Like I said, don't act on it either. Just observe and allow. And here's the thing. This is the part where people resist and have a hard time with, because if they're doing it correctly so far with this step 4, the emotion will actually get more intense. It will actually get more intense. That doesn't mean it's not working, this technique. That actually means it is working. So, but that's the part where people quit and they're like, oh gosh, I don't want to feel this. I don't want to feel this. I shouldn't feel this. I'm doing something wrong, or I don't want, the resisting. And the resisting is the problem, because when you release and surrender the resistance, that's where the letting go of this emotion for good actually happens. So, yes, basically the way out is through. And it is said that if you don't resist or feed the emotion and let it run its cycle, it will turn to joy or neutrality at the very least. And you'll be surprised that it actually does. This does work. Like I said, it's not necessarily the easiest thing to do, but it's more simple than you think. Give yourself some credit. Give it a try and see what happens. Again, give yourself permission to feel the feeling. This whole thing, emotional mastery in general, again, it's not about not feeling the feeling. In fact, for this, technique, a lot of times we need to feel the feeling in order to let it go. Otherwise, again, we're suppressing it, repressing it, hiding from it, escaping it, or expressing it in not necessarily healthy ways. So like it is about feeling the feeling so that we can surrender and let it go. And this is a technique that helps with that. Because yes, resisting the emotion really just feeds it. I just want to make that clear also. I have a book recommendation if you're more interested in like a deeper dive on this. I have it right here actually. Letting Go by Dr. David Hawkins. I think I'm actually going to read just a really short paragraph here that kind of like puts things into better words, his words. Okay. Letting go involves being aware of a feeling, letting it come up, staying with it, and letting it run its course without wanting to make it different or do anything about it. It means simply to let the feeling be there and to focus on letting out the energy behind it. The first step, now these steps are not, his steps have nothing to do with this technique. They're made by different people, just to be clear. The first step is to allow yourself to have the feeling without resisting it, venting it, fearing it, condemning it, or moralizing about it. It means to drop judgment and to see that it is just a feeling. The technique is to be with the feeling and surrender all efforts to modify it in any way. Let go of wanting to resist the feeling. It is the resistance that keeps the feeling going. When you give up resisting or trying to modify the feeling, it will shift to the next feeling and be accompanied by a lighter sensation. A feeling that is not resisted will disappear as the energy behind it dissipates. So hopefully that helps clear it up a little bit. This is by a psychiatrist, by the way, and also an amazing spiritual master. Okay, so I think that's enough for today. Yes, I recommend taking notes on that technique. Rewatch again, take notes if you didn't the first time. Next week, we'll do part 2, where we'll go over another technique, the treating the shoulder, which is geared more for emotional transformation of past significant emotional events. And again, the reason this is important and relevant to Cancer is because your emotional and mental well-being absolutely have an effect on your Cancer response and outcome. So yes, I guess that's about as plainly as I can put it. This should be a source of empowerment, though, not fear, because you do have the power within you to change your state. Absolutely. All right, everyone, I'm Dr. Lisa. Please subscribe if you haven't already. Like, comment, so that hopefully this video can reach and help more people like yourselves going through this journey. And all right, till next time, much love, everybody.